Providing high standards of healthcare for everyone in Oman is one of the top priorities of the government. Hence, the Ministry of Health has paid great attention to the provision of all forms of healthcare in its all levels and made it accessible by everyone, everywhere in the Sultanate. Sohar Hospital was inaugurated in October 16, 1997. The hospital provides healthcare services to the people of North Batna Governorate with a population of more than 600,000 people. Our vision is to be recognized as the institution of choice for healthcare services among patients, community, and healthcare professionals. Our mission at Sohar Hospital is to provide high-quality patient care supported by clinical excellence and patient safety. We are passionate and committed to ensure the very best healthcare for those we serve. Our value is to provide high-quality healthcare with integrity and service excellence in a caring environment. Besides the general medical specialties, the hospital includes numerous subspecialties with inpatient services that accommodate 408 beds. The hospital also provides emergency services through the Accident and Emergency Department. The department is equipped with all modern technologies and well-trained team to receive and manage emergency cases effectively around the clock. The department receives around 200 visits per day. As a step toward excellence in healthcare services in Sohar Hospital, the Patient Safety Friendly Hospital Initiative was launched on November 3, 2016 with the involvement of the community leaders. The participation in this initiative came under the theme Together for the Patient Safety. The launching event aimed to involve and empower the community and to educate the public and clarify their role in the patient safety. The event also included various awareness programs and an exhibition on the patient safety. All of the hospital departments, internal units, and outpatient clinics participated under the theme Together for the Patient Safety. This initiative involves the implementation of a set of patient safety standards in hospitals. Compliance with the standards ensure that the patient safety is accorded the necessary priority and that the institution and its staff implement the best practice. The standards are organized under 5 main domains. These are leadership and management, patient and public involvement, safe evidence-based clinical practice, safe environment, and lifelong learning. The actual phase started by allocating special team to be the steering committee for the initiative. This team was selected according to specific criteria to lead the decision-making process, facilitate the work and task achievement of the initiative. The initiative awareness activities started from within the hospital, targeting doctors, nurses, paramedics, and all members of other services. The theme, Together for the Patient Safety, is placed at the main entrance of the hospital as an approach to raise awareness, ensure continuity, and encourage everyone of the staff and society to get involved. The circle then was expanded to include the community with its all different sectors. This was achieved through organized and scheduled events targeting the commercial centers, schools, government and private institutions, some councils of sheikhs, shura members, associations in the area, volunteer groups, and sport teams. These events and meetings were followed by the steering committee to discuss the difficulties, identify the most important points, and find solutions for improvement. In order to develop relations and cooperation between healthcare institutions, the Patient Safety Initiative team in Sohar Hospital visited other hospitals that participated in the initiative in order to enhance relations and benefit from the distinguished expertise in the field. The patient safety strategy was one of the priorities that focused on several aspects, including the safety of medicine. In that matter, the clinical pharmacy unit was opened and the system was developed. It focuses on how to deal with a high concentration medication alongside with look-alike and sound-alike medications. The patient identification has been on the top of the agenda for the hospital's team. The aim was to prevent medical errors that are becoming increasingly unacceptable worldwide. The patient safety strategy also focused on enhancing hand hygiene and its importance in saving lives among both healthcare workers and community members. The hospital has organized several workshops and events that help spread the awareness of the importance of hand hygiene at the governorate level. Providing all patient-specific information, referred to clinically as the handing over, is applied when transferring the patient from one ward to another within an institution and during the patient transfer between different institutions. Sohar Hospital adopted BAR approach, which is recommended internationally to prevent errors while transferring patients. The first Employees Gathering Day was a big ceremony that was held for the first time at Sohar Hospital. The ceremony included honoring a large number of recognized hospital staff from all medical, paramedical, and the services in the hospital. To motivate the team to perform better and improve the practice, the leadership walkarounds had a significant impact on the performance of the employees. It enhanced the practice, improved the service provided, and motivated the employees to achieve more. The initiative was an encouraging factor that provided an opportunity for creativity and excellence in all services provided. Several projects have been achieved during the past period. For example, the launching of Sohar Hospital electronic portal to be the main source to raise the awareness of patient safety among the hospital employees and achieve the objectives of the strategy. Sohar Hospital has also implemented healthcare waste management project. The project aims to reduce unnecessary waste, isolate public waste from those risky to healthcare workers and or community, choose a suitable place to collect the waste, dispose the waste in an environmentally friendly manner, and raise awareness among the employees. The social networking services like Twitter and Instagram were activated to present and display the activities related to the patient safety initiative. They also represent a wider link between the hospital and the society. The Top Management Review Day, with the involvement of community leaders and patients, represented a collaborative approach to enhance, improve, and achieve the best. The event included presentation of statistics for hospital indicators, discussed the analysis of events and complaints, displayed the recommendations for follow-up and improvements, and the report that will be reported to the Directorate of Quality Assurance Center at the Ministry of Health. The event also involved an exhibition that held the theme Together for the Patient Safety. Patient and public involvement is one of the domains of the initiative that has a great role in improving the service in terms of spreading awareness in the areas related to patient safety in the society. The patient and public involvement team participated in several activities covering all aspects of the initiative and introducing it to the community. The team also has collaborated with different governmental sectors and participated in various events that targeted the awareness of the community and the role of the society in the patient safety.
ما شاهدناه في ملتقى الأسرة الذي تنظمه جمعية النور للمكفوفين لمحافظات شمال وجنوب الباطنة والظاهرة بصحار، وحقيقة ملتقى جيد وجميل يجمع الأسر من مختلف مناطق التابعة لها الجمعية. وشدني كثيرا هذه الخيمة الصحية التي جزاهم الله خير مستشفى صحار.
بسم الله الرحمن الرحيم. حقيقة ما وجد في هذه الجمعية هو خير دليل يعني على وجود جهود مخلصة وجهود صادقة من قبل الأعضاء وهذا التفاعل يعني الذي يعني يوضح مدى الاهتمام والمتابعة ليس من الآن ولكن منذ سنة.
Furthermore, the team has conducted meetings with community leaders and active community members, such as volunteers groups, and has established a collaborative network to enhance the service and involve the community. This network includes focal points from the community participating to this team by offering ideas to improve the service. The team also has trained the community focal points to be active links between the hospital and the community to spread and enhance the culture of patient safety, including the patient rights and responsibilities. In addition, the Department of Internal Medicine activated the health information page on the social media to benefit the society. The page has frequent healthcare messages and instructions that aim to raise the awareness in the community about patient safety and health-related issues. The page is intended to involve other specialties in the future. The staff of Sohar Hospital received the first and second assessment with confidence. They are committed, passionate, and ready to face the challenges. The assessment involved several aspects and covered most sections and departments of the hospital. The starting point was the policies, the staff training, compliance, and monitoring of the practice with follow-up steps. The assessment also included interviewing patients and hospital employees. The final results and recommendations were starting points for improvement. It's worth mentioning here that the support of the top management was one of the main motives to improve and move forward. From here, the work started on the recommendations and the development of continuous plans to maintain quality performance and support the staff to reach the highest service standards and meet patient satisfaction. Step by step, a large number of policies that were not existent or implemented without follow-up have been developed and updated. The change was noticed through activating the correct policies, training the staff on standard application of those policies into the practice, and following them with continuous evaluation. For this is an open invitation to all. Join us. Come together for patient safety.